Dry eyes have become a very common condition among individuals worldwide, with 1 in every 3 people having it. Whether it's caused by situational factors or other conditions, many treatment options have become available nowadays to treat dry eyes. Hi, I'm Dr. Preethi, Director of Regenerative Aesthetics, Hair Restoration and Dry Eye Services at Eagle Aesthetics and Surgery. Today, let's talk about everything you need to know about dry eyes, from what it is to how it can be treated. Get more insights on aesthetic medicine, oculoplastics and even plastic surgery today. Subscribe to our channel to hear more from all of us at Eagle Aesthetics and Surgery. Dry eyes are a very common chronic condition faced by many people worldwide. It happens when you are unable to produce enough tears to lubricate your eyes, leading to feelings of discomfort, irritation, redness, blurry vision, and even increased tearing as your eyes try to compensate for the dryness by producing more tears. Your tears actually play a very important role in keeping your eyeballs comfortable as well as functional. Tears are actually made up of 3 layers. The meibum is the first layer. It is an oily layer followed by water and mucus. The oily layer helps to prevent the water layer from evaporating or drying up too quickly. Dry eyes can be a result of situational factors like spending too much time in an air-conditioned room, looking at the computer for too long, or even when it is too windy outside. It can also be as a result of other factors such as meibomian gland dysfunction, where the meibomian glands in the eyelids are blocked or clogged and less oil is able to reach the surface of the eye. This leads to your tears evaporating very fast, leaving your eyes feeling very dry. It can also be caused as a side effect of other eye surgeries or laser corrections. This is because procedures such as LASIK can temporarily damage the nerve endings in your eye, which can cause the nerves that help to regulate the tear glands being unable to detect when your eyes are drying out. As a result, your tear glands are no longer told when to produce tears when needed. If you're experiencing dry eyes, it can be caused by any of these factors or even a combination of these. Your doctor will be able to help assess and evaluate your condition during a consultation to help you understand the root causes of your symptoms. So, how do you diagnose dry eyes? First, your doctor will begin your treatment with a comprehensive and a detailed evaluation of your condition. This may include clinical examination as well as non-invasive imaging tools to understand the root cause of your condition. Usually, this includes tools like a slit lamp examination, which can help to examine your entire eye in detail. Other tests include tear breakup time, which helps to measure your tear film stability, tear meniscus height, which helps to measure the volume of tears produced, Schirmer's test, which measures the baseline tear production. After this comprehensive assessment, your doctor will help you to develop a customized treatment plan for your dry eyes. Dry eye treatment is not one size fits all. Depending on your diagnostic results, your treatment can range from medications and supplements like lubricating eye drops, gels, ointments for immediate relief, anti-inflammatory eye drops to help calm the eye surface, oral supplements to improve the quality of your tears as well as to reduce the oil gland inflammation. For acute cases of dry eyes, prescribed medication like eye drops and supplements may be enough to help you manage your condition. However, for more severe cases of dry eyes, specialized treatments may be needed. For example, this may come in the form of in-office treatments like broadband light therapy. In broadband light therapy, we use an intense pulse light-based treatment to target inflammation and improve the oil gland function. This is especially helpful for cases of meibomian gland dysfunction. And the second in-house treatment we offer is called envision. This combines intense pulse light-based therapy along with radiofrequency energy to treat both inflammation as well as gently heat the skin around the eyelids in order to encourage better gland expression and tear stability. This can help to ensure that your tear glands are unblocked and happy, with the additional benefits of improving the fine lines and wrinkles in the delicate eyelid skin around your eyes, helping to refresh your look. These 2 treatments can be used in combination to help relieve your dry eye condition depending on your needs and consultation with your doctor. As dry eyes may be caused by a variety of factors, there are no hard and fast rules about preventing this common condition. For example, if your dry eyes are caused by being in dry environments for a prolonged period of time, you can consider adding moisture into the area with a humidifier or using artificial tears regularly to keep them well lubricated. If your dry eyes are caused by air blowing directly into your eye, consider wearing protective shields to the tops and sides of your eyeglasses to help block the wind and dry air. For dry eyes caused by long periods of screen time, make sure you take a break between long tasks and keep your screen position below your eye level so that you don't have to open your eyes very wide. This can help to slow down the rate of evaporation of your tears. If you have been struggling with dry eyes, you're not alone. Many treatments are now available to help you manage this condition better, from simple treatments to even long-term solutions. Speak to us at Eagle Aesthetics and Surgery to find out more. For more questions, feel free to reach out to us for assistance.